with the stigma of AIDS. Nobody on earth wants to be associated with the stigma of AIDS.
Controversy follows naturopath Dr. Bangura Bangs wherever he goes. Today is no exception. Under the Wisdom Tree at Fourabay College, he explains his theory of the origin of the HIV virus.
The American government at one time gave US scientists $550 million to create a virus that will be more akin to people of color. There are population scientists who are worried that if populations are not controlled, after some time the world will be overpopulated in such a way that there will not be enough room for anybody to survive conveniently.
Sierra Leoneans are willing to listen to his viewpoint. This is not surprising, considering many in the West African nation are suspicious of how the virus came about, while others question whether the virus is real or not.
I do not believe in it.
Yeah, I believe. Say it's there. I do not believe it exists.
So I go feel say it there.
Partially I believe. Then on the other hand again, I can say I'm a little bit skeptical.
I do believe 120%.
I would say no, I don't believe in HIV and AIDS.
That this question is up for debate could explain why the number of people living with HIV/AIDS in Sierra Leone has increased 40% since 2002. Dr. Brahma Kargbo, director of the National AIDS Secretariat, has watched this number rise.
We had our first seroprevalence survey in the year 2002, in which the prevalence came out as 0.9%. So after 3 years, we did another survey in 2005, it came out 1.53%. So definitely it's on the increase.
As the rate of infection rises, so does the population's knowledge of the disease. Over 85% of Sierra Leoneans have basic knowledge of HIV/AIDS. Knowledge of HIV/AIDS is rising, but why doesn't this translate into belief?
I have no evidence, like to say if I see somebody with tuberculosis, somebody that got tuberculosis, I can tell that this person has tuberculosis, right? But somebody with HIV and AIDS is rather difficult to believe.
But because I'm in the field as a journalist, I film so many HIV cases and I come across most of them, I saw most of the symptoms in them. That makes me believe.
I think what the Sierra Leone population wants is to see somebody, a skeletal individual walking, they say that person has AIDS. No, you can have the virus, you live your normal, healthy, productive life. Now with the availability of antiretroviral drugs that we give in on time, people do not reach up to that stage.
This suspicion of HIV/AIDS can be traced back to the Western world.
And AIDS is just the mere American intention to discourage sex. You may want to ask, why would America want to discourage sex? I believe the population is growing far, far beyond what the earth can accommodate, and maybe they want to cut it down, and that is why they brought up this thing called HIV and AIDS.
The international community has been active in trying to curb the spread of HIV/AIDS in Sierra Leone. Over the years, the message of monogamy and abstinence has overshadowed that of condom use. Many believe HIV/AIDS, real or not, is a conspiracy to control the population of Africa.
If you look into the population of Africa, Africa is growing at a very faster rate. One man can have more than 3 or 4 wives and can have more than 17 or 18 children, just a single family. And the international organization, it has been a burden to them in assisting us, saying we pour money to these people, but these people are producing every day. So what's the cause? How can we see that we curtail some of this? And I think they decided to implement the strategy of HIV and AIDS.
HIV infection rates are rising, but the population is still not convinced that the epidemic is real. And no organization seems to be asking if Sierra Leoneans believe in HIV/AIDS. Only 10% of surveys performed in the last 10 years have measured the population's belief in the virus and syndrome. Investigating this skepticism may be the only way to halt the spread before it is too late.
Whichever country gets a 5% prevalence, it means the disease is going to be increased exponentially in the double digits, and we are afraid for us not to reach up to that stage.
Greg Crompton and Abubakar Jallo, Freetown, Sierra Leone.